Welcome everyone. My name is Tim Wood. I am the founder and broker here with SafeMoneyRetirement.com. Got a lot of clients, especially ones that are new to Medicare or that are approaching Medicare, that have a lot of questions about how Medicare works. So I created this presentation. It's going to be very brief and it will explain a lot about how Medicare works, and it should clear up a lot of the questions. So real quick in this video, we're going to cover who is eligible for Medicare and when, what Medicare is and how it's different, all its different parts work and how they work together, what your options are, a general idea of costs, some important dates, and more. So here we go. Let's go ahead and jump in. So what is Medicare? Well, it's our nation's largest health insurance program. And as of 2019, it was serving over 60 million. So you know it's more now. It's run by the Centers for Medicare and Medicaid Services, or CMS, a lot of people call it. And President Johnson signed it into law back in 1965. Now, Medicare basically has 5 parts. A and B are original Medicare. C is Medicare Advantage. D is a prescription drug plan. And then you've got supplements that help cover the gaps in original Medicare. And sometimes that's called a Medigap plan. Now, we're going to go over all of these here today in detail. Now, generally, Medicare Part A and B are available for people age 65 or older. In some situations, even if you're still working, that's on a case-by-case basis. You may also be eligible if you're a younger person with disabilities or someone with end-stage renal disease. You can enroll in Medicare for the 3 months leading up to your 65th birthday, during the month of your birthday, or the 3 months immediately after your 65th birthday month. So you've got a 7-month window there. If you haven't enrolled by that 3rd month after your 65th birthday, you're subject to ever increasing late penalties. So you'll need to get started as soon as possible to avoid paying those fees, because you pay them for the rest of your life. They're not just a one-time fee. So let's get into the parts of Medicare. Original Medicare covers most of your care from doctors and hospitals and has a deductible and co-insurance just like traditional insurance. Part A is your hospital coverage. It also covers skilled nursing, hospice, and home health care. If you've worked at least 10 years in a full-time job in the US during your lifetime, this coverage is provided with a $0 premium. Now, there are deductibles and co-insurance that you have to pay with every hospital stay. Basically, anything that has to do with a hospital stay is going to be covered under Part A. Part B is your doctor's appointments, outpatient and preventative services, physical therapy, and some other things. Now, most people pay $170.10 per month for this coverage, and it has a $233 per year deductible. Now, those numbers are current as of 2022. They're going to keep going up. And then 20% of Medicare approved amount is co-insurance, which is the part you pay. Now, there are no out-of-pocket maximums for either Parts A or Part B, and neither includes prescription drug coverage. Now, this is a big deal, because no maximums and no drug coverage means you could have a massive bill if something major happens. There was no need for prescription drug coverage when this program became law back in 1965, so they didn't include it in original Medicare. That's where Parts C and D come in. These are offered by private insurance companies. They are not from the federal government. Part C is the same as Medicare Advantage. I'm sure many of you have heard about that, seen the commercials, gotten tons of mailers and all that stuff. It covers everything Parts A and B cover, so your hospital and your doctors, and typically includes much lower deductibles and co-insurance costs, lower out-of-pocket maximums, and other services like prescription drugs, dental, vision, gym memberships. A lot of them have a lot of different fringe benefits. Part D plans are standalone drug plans. Now, we're going to get into more detail for Parts C and D in a minute. Here are your options. Almost everybody gets Medicare one of 3 ways. First is just original Medicare, just parts A and B, hospital and doctor, and this is through the federal government. Now, the challenge with this first option is that there are, once again, like I just said, no out-of-pocket maximums. There are deductibles, co-insurance, and no drug coverage. But some people still choose just to do parts A and B, and that's their choice. The second option is adding a Medicare supplement plan along with a prescription drug plan. Now, this basically covers the gaps in original Medicare and would provide drug coverage. These plans are somewhat pricey, but they can be great in certain situations. The third option is a Medicare Advantage plan, which includes Part A and B, and typically includes many benefits and services original Medicare does not, with much lower deductibles and out-of-pocket maximums, and most include drug coverage. I would say out of these three options, most choose option 3, but these 3 options are going to cover over 99% of everybody in America. One of these 3 ways is going to work for them. So, as far as important dates go, there are 2 main election periods every single year. First is what you've heard of called as AEP, stands for Annual Election Period. That runs from October 15th to December 7th every year. During this time, you can select your Medicare Advantage and prescription drug plans to start the following year, January 1st. Now, this is generally the only time you can make this change unless your situation falls under a special enrollment period or SEP. And there are a number of different types of SEPs, like moving, leaving an employer plan, losing current coverage, your current plan changes. There's several different SEPs you may qualify for. Also, if you have Medicaid coverage through your state, you can change plans anytime. Now, when you're making your choice for Medicare, there are several main factors to consider. First, cost. How much will you pay for premiums, deductibles, co-insurance, and co-payments? You have to make sure it's going to work with your budget. Next is what benefits are provided with each option. Does the option you're looking at include prescription drug coverage? Does it have an out-of-pocket maximum? These things make a huge difference, and you need to make sure that you're going to get the coverage that you need that's going to work best for you. Then there's convenience, making sure the plan's in-network providers are close to you. Then what you think your needs will be. Have you needed care in the past few years, and do you think that may increase? And lastly, are your doctors and preferred hospital accepted by the plan? Once you weigh out all of these factors, typically one option really jumps to the front of the line and stands out as the best choice. Now, you have to watch out because there can be a massive difference in yearly out-of-pocket cost between options. The 3 deciding factors in which way will work best for you are your history, like do you have a chronic condition or take really expensive medications, and will your needs grow in the near future as far as you know? What prescription drugs do you take? What you'd spend now and what you could spend in the future? And lastly, do you need more coverage than parts A and B can provide, and lower deductibles and a yearly out-of-pocket maximum? Now, let's look at Part C, or Medicare Advantage, more closely. In order to enroll in Medicare Advantage, you must already have Parts A and B. So again, you must go ahead and get enrolled in Parts A and B when you become eligible. Then you can look at adding on a Medicare Advantage plan. These plans sometimes have an additional premium. I do see that. But in many cases, and I would say over 80% of the cases that I work with, they have a 0 premium. So all you're paying is that Part B premium, and you're not paying anything extra for all the advantages of these plans. You must keep paying that Part B premium, by the way, and remain a Medicare member, or you would get dropped from the Advantage plan. You may also have the opportunity to select additional benefits like dental, vision, or prescription drugs. Now, there are basically 4 types of Medicare Advantage plans. First is a health maintenance organization, or HMOs, we've called them for years, which you probably are already familiar with. You would have a primary care doctor that would refer you to others in the network when you needed it. With an HMO plan, you must stay in network for your healthcare costs to be covered. Now, the good thing about it is there's a lot of these Medicare, I won't say a lot, there's several of these Medicare companies that offer these plans. You have to stay in their network, but instead of the network just being around your home, it's now their entire network nationwide. So a lot of these plans have really expanded to allow people to go to different parts of the country and still have full coverage. A preferred provider organization, or PPO, lets you choose any provider that accepts Medicare, but you typically pay less if you stay in network. So it just gives you some options. A private fee-for-service, or PFFS plan, may give you more freedom, but all doctors don't have to accept it. And the insurance company, not Medicare, determines how much you will pay for services. So you got to be careful with that. Lastly, special needs plans, or SNPs as we call them, are special plans for those with chronic conditions or that are in long-term care or skilled nursing facilities. Each type of plan has its advantages and disadvantages. You need to look at all of your options and make sure you're making the best decision for your specific situation. Now, just a little bit more about those SNP, or special needs plans as they're called. They are typically more focused on specialized healthcare to deal with whatever the special need is. In order to join a SNP, you must have both parts A and B and either a chronic illness like diabetes or heart condition, there's several of them, receive Medicaid assistance from the state, or reside in a nursing home or need nursing home care. Now, SNPs include all Part A, B, and D benefits. The great thing about these SNP plans is they're designed specifically around specific special needs. For example, if you were diabetic, there's a SNP plan there's SNP plans that are focused on diabetes management, diabetes testing supplies, insulin, blood tests, and things like that. So they're made specifically for whatever your specific situation is. They're like having a policy designed with your needs in mind. The extra benefits that come with Medicare Advantage make it very attractive to many people. These include gym memberships, prescription drug plans, vision plans, dental plans, mail order pharmacy, nurse hotlines, virtual doctor visits, and annual out-of-pocket maximums. That last one is the most important. Once again, original Medicare, no maximum out of pocket, and it can get huge, as you can imagine, going to doctors and hospitals. Once again, no limits on original Medicare, but these have limits. Each plan is different, so you must see what's available for you in your specific area and determine what's going to work best in your situation. Now, let's briefly cover Medicare supplement plans. These plans, once again, like I said, they're also called Medigap plans. They work with original Medicare Parts A and B. They're designed to pay some of the costs Parts A and B don't, like co-pays, co-insurance, and deductibles. Each Medicare supplement plan is unique, but typically has a much higher price tag than a Medicare Advantage plan. However, some people want this type of plan because costs can be more predictable and they can see any provider they want that takes Medicare anytime. So a lot of people like those plans, but like I said, they're very pricey. Now, if you have one of those plans, or if you've just got A and B, you need Part D if you don't have a Medicare Advantage plan that includes your drugs. Now, Part D is exactly what it sounds like. That's prescription drug plans. They are available from private companies that contract with the federal government and are required to offer the basic benefits Medicare requires. After that, each plan has its own list of drugs, which is called a formulary. So you need to make sure you choose one that includes the medicines you take regularly. Now, there are two ways to choose a Part B plan. First, you can buy a standalone PDP plan, prescription drug plan to help cover medicine costs. Or you can get a Medicare Advantage plan that includes Part D coverage, and that's called actually an MAPD, Medicare Advantage Prescription Drug. So they're all in one. Once you're in an MAPD, you don't need additional drug coverage as it's already included in your Medicare Advantage plan. Now here's the challenge with Part D. It's the dreaded coverage gap or donut hole. I'm sure you've heard about this, where you will likely pay a much higher percentage of drug costs. Now you move in and out of this gap when your total cost reaches a specified dollar amount and the maximum changes annually. For 2022, there is a maximum initial deductible of $480 that you pay all of, 100%. After that, you pay 25% of the drug cost up to $4,430. Now, again, these numbers are for 2022. They're going to change. They keep going up every year. The costs do, of course. After you've passed that $4,430 mark, you enter the donut hole. After $4,430 and all the way up to $7,050, once again, this is for 2022, you pay 25% of the drug price. Big difference between drug cost and drug price. So that's the donut hole that you can wind up dropping a lot in. After you surpass that $7,050, you pay approximately 5% of the drug price as you've entered what is called catastrophic coverage at that point. These are dollars you definitely need to think about when choosing the right prescription drug coverage. There are multiple resources available at medicare.gov. This includes the Medicare and You Handbook and the Choosing a Medigap policy guide. At shiptalk.org, you can get information about your state health insurance program, and you can contact your state Medicare office and Social Security Administration to see if you qualify for extra help to help you pay for prescription drug premiums and costs. Now, here are our last few words to help you with your choices. Part D plans, Medicare Advantage plans, and Medicare Supplement plans all have separate premiums from original Medicare. That means you still pay that $170.10 as of 2022 monthly premium for Part B in addition to whatever else you choose. Now, as I mentioned, some Medicare Advantage plans have a zero premium, but all standalone Part D plans and Medicare Supplement plans have an additional premium, all of them. So if you're looking for more coverage than original Medicare and something to help with those deductibles, co-insurance, and no out-of-pocket maximums, you can choose a Medicare Advantage plan or a Medicare Supplement and a Part D plan. Just select the coverage you want for the price that works for you. Your costs depend on the coverage you choose. Medicare Advantage costs depend on whether the plan charges a monthly premium, pays any of your monthly Part B premium, because some do that, depending on what your level of help you can get from the government is, and what the co-pays, co-insurance, and deductibles are. Both original Medicare and Medicare Advantage plans cover some preventative services, and Medicare Advantage plans are required to cover everything original Medicare does without exception. So you'll never get less with a Medicare Advantage plan. Thanks for your time and attention today. Hopefully this helped clear up how Medicare works and how you can move forward. My suggestion to you is to find a professional that can help you make sure you're making the right decision. And you will never pay more to go through a certified agent. Their service is completely free to all Medicare subscribers as they are paid by the insurance companies. I would also recommend going with an agent that is certified with all of the available Medicare Advantage plans in your area, and preferably that is also a certified financial fiduciary, so you know they are working on your behalf 100% of the time. Thanks again. My name is Tim, broker owner at Safe Money Retirement. We're here to help you if and when you need us. You can find more information at safemoneyretirement.com. Thank you so much. Take care.